I recommend telehealth to my patients because it's convenient, and physical therapy is something that you're able to do over video conferencing or telehealth. I think that you can use telehealth even for patients who you may not think telehealth is going to be enough. It may be a great combination that a person could come in, they could be assessed, and you could set up a program for them to start doing at home. And then for any of those reasons, a busy schedule, difficulty driving, that maybe they just have a follow-up through telehealth, and the treatment can become a combination of telehealth and in-person visits in order to make it more convenient and possibly increase the amount of visits that you're able to see a person. You go about the evaluation in much the same way. You may not have all the equipment and options of doing things here like you do in the clinic, but you evaluate the person's needs, you figure out what their limitations are, and then you implement exercises and functional activities to address those limitations or address their pain. I feel like that's a huge advantage of being able to actually see someone in their home. Not only are you teaching them how to do exercises or teaching them how to deal with their pain in an environment that they're in every day, you can also really look at their functional limitations firsthand. So if you have a mom who's having trouble getting their baby out of the crib, or somebody who, you know, can't get certain things out of high cupboards in the kitchen, you can actually watch them doing the exact task that they're having trouble with and help them to modify how they're doing it or give them suggestions on how they could do it easier. And so when somebody realizes that they can do an activity or they can do a movement or a stretch and that affects their pain and they feel better, that's really powerful. That gives the person so much control to be able to manage their own condition. And in physical therapy, ultimately that's the goal, is to make the person or help the person become independent with managing their condition and not be dependent on me.